The Public Health Agency of Canada was the largest spender on public opinion research, outpacing 35 other departments, with the majority going to key insights into national vaccine coverage. The Government of Canada's 23rd Annual Report of Public Opinion Research Activities was released earlier this month, and it details millions in government spending about research projects executed by departments and the roles of key stakeholders involved. The total cost of contract value was $19.4 million across 36 government departments. There were only 4 departments that spent millions on these activities. As mentioned, the largest spender was the Public Health Agency of Canada, at a whopping $3.5 million and change. Next up was the Privy Council Office at $2.2 million and change, followed closely by Health Canada at nearly $2.1 million in spending, and lastly, the impossibly frustrating bureaucracy to deal with, the Canada Revenue Agency at $1.2 million and change. Both the Public Health Agency of Canada and Health Canada comprise the country's national health portfolio. These agencies are responsible for national health policy, disease prevention, and regulatory oversight, but have faced mounting criticism and distrust after the abysmal handling of COVID-19 response at the hands of Chief Public Health Officer Theresa Tam and Ministers of Health Patty Hajdu, then Yves Duclos, and now Minister Mark Holland. The lion's share of their research pertained to assessing national vaccine coverage, nearly 293,000 on childhood COVID-19 immunization coverage survey, 122,000 on childhood immunization coverage survey among key at-risk and equity-deserving Canadian populations, the general population and recent immigrant parents, over 38,000 on the same for healthcare worker parents, nearly 28,000 for again the same but for Indigenous parents, over 106,000 for the same but specific to 2S LGBTQIA+ and men who have sex with men parents, nearly 63,000 on childhood vaccination advertising campaigns, almost 300,000 on estimation of post-acute conditions associated with COVID-19 vaccine impact and effectiveness among children and adolescents, over 107,000 on Mpox immunization coverage in the 2S LGBTQIA+ and men who have sex with men communities, another 300,000 on seasonal influenza coverage, 295,000 to conduct a survey on vaccination during pregnancy, 296,000 on vulnerable and hard-to-reach populations COVID-19 immunization coverage. One of the most costly research papers was that estimation of post-acute conditions associated with COVID-19 vaccine impact and effectiveness among children and adolescents in Canada. Again, nearly $300,000 went to this, but the result was this mediocre 2-page brief with nearly 1 full page dedicated to references. It concluded that there's low confidence in these findings as the evidence was limited by the number of studies, lack of peer review, and risk of bias in the retrospective studies. Peer-reviewed, longer-term prospective studies are needed. Canadians paid $300,000 for a study that ultimately admitted to low confidence in its findings. Speaking of COVID vaccines, as reported by the Hill Times, the more recent instance of public opinion influencing government direction was during the COVID pandemic when it came to decisions around mandates and the COVID-19 vaccination program. The Hill Times sources assistant professor at Queen's University, Eugene Lang, who, quote, suggested that during the pandemic, public opinion polling, especially regarding those hesitant to get vaccinated, likely had a big impact on how the federal government conducted itself, end quote. He furthered that the government communication, otherwise known as messaging, can be a substitute for policy or part of the policy when trying to change the population's behavior. Indeed, that did happen here in Canada. Our health agencies aimed to modify public behavior to align with evolving science, which turned out to be based on hysteria rather than evidence-based research. World Health Organization Director General Tedros Ghebreyesus confirmed that this occurred throughout the COVID pandemic and even spawned the creation of a new behavioral sciences unit.
Governments have had to persuade their populations to accept new behaviors and conditions, all in the context of rapidly evolving evidence. As part of our transformation, we created a new unit for behavioral sciences to integrate evidence about why people make the decisions they do into our programs and policy work.
WHO roundtables revealed that Canada has long led behavior change initiatives, while Theresa Tam has been using extensive data collection and psychological operations to enforce compliance since the pandemic began.
Coming back to evaluation and science, I think it's important when applications are being stood up that there is an actual integrated evaluation and research aspect to them. Otherwise, you have no idea whether they work or they don't work. So maybe government can at least play a role in that space. We've certainly seen a growth of these applications, and we have our own applications too that nudges people or reward them for healthy behaviors or giving them badges or these kind of rewards. And I don't see people doing that research as much as we would like. So maybe I'll turn it back to chief science officers to see if they can help. But I think regulation of social media platforms is the one that governments have been really engaged in, and that's quite a massive piece of space of regulation that is still undergoing debate.
This misuse of taxpayer dollars to fund research on the same public these departments want to shape the behavior of raises serious concerns about the goals of government, but also about spending accountability, especially when it results in low confidence findings and questionable policy outcomes. For Rebel News, I'm Tamara Ugolini. The COVID-19 response will tarnish Health Canada and the Public Health Agency of Canada's reputation for years to come. To explore how pharmaceutical interventions have fueled distrust in these health departments, visit nomoreshots.ca. There you can consider supporting my work and signing our petition calling on Federal Minister of Health Mark Holland to revoke market authorization for the novel COVID-19 injections. All of that at nomoreshots.ca.